Next, we have Dr. Natasha Ruby. She's going to bring a mental health message for us today. Dr. Tosh, you have the floor.
Thank you so very much. And I've been having a little bit of difficulty with my system this morning, but I worked it out to where I'm on here twice. So can you please allow me to share my screen?
You got it.
Thank you. Okay, are you able to see my screen?
Yes.
Okay, great. Okay, so good morning, Lifeline. Thank you so much for having me today. I'm Dr. Natasha Ruby, aka Dr. Tosh. I completed my research on workplace ACEs, adverse childhood experiences, and it is a delight this morning to share with you this presentation for Black History 2024. So, toxicity at the workplace, an investigation of adverse childhood experiences, workplace stress, and health outcomes. On average, 30% of a person's life is spent working. Occupational stress contributes to poor employee health outcomes. A goal of the previous Healthy People 2020 regarding occupational safety was to prevent adverse health outcomes due to working conditions, including occupational stress. So the specific directive was to increase the proportion of employees who have access to workplace programs that prevent or reduce employee stress. Adverse childhood experiences, also known as childhood trauma, may play a much larger role in work stress and organizational challenges than we realize. So I'm going to go ahead and define occupational stress and workplace stress. Occupational stress is a chronic condition of negative psychological and physical effects an employee experiences due to the responsibilities, environment, or other pressures of the workplace. And then workplace stress is the harmful physical and emotional responses that can happen when there is conflict between job demands and the employee and the amount of control an employee has over meeting those demands. So here are some of the physical symptoms of occupational stress. There's aches and pains, chest pain or rapid heartbeat, exhaustion or trouble sleeping, high blood pressure, dizziness. And so it kind of goes over and just elaborates on it a little bit, but for the sake of time, I'm just going to read the bulletin. Okay, so then you have emotional and behavioral signs. So changes in moods, agitation or feeling on edge, avoiding social interactions, grumpiness or anger, getting sick more easily. Okay. And then I'm going to go ahead and talk to you a little bit about adverse childhood experiences. So the Kaiser Permanente study that was done in the 70s, they took a time to look at, the original focus of the study was childhood obesity. However, from that study, a whole other array of different things that could be linked to the study was also found. So it looked at 10 different types of traumas that you are impacting on a person's life, right? So here they are. So they're recurrent physical abuse, recurrent emotional abuse, sexual abuse, an alcohol or drug abuser in the home, an incarcerated household member, someone who is chronically depressed, a mother being treated violently, one or no parents, emotional or physical neglect. Okay, and this is the scale. You could find it online if you ever want to take yours. Pretty much how it works is you just answer, you put yes for each event that has happened within your lifespan from 0 to 18 years of age, and then you total that up. And anything that what it was found was whatever statistically significant is, anything 4 or more is a positive predictor variable for if you've possibly been exposed to toxic stress. And if so, that increases the chances of you having different deleterious diseases. But it's not meaning that it will definitely happen. It's just a predictor variable. Okay, so the role of adverse childhood experiences on occupational stress. So people with a higher ACEs score or an increased number of traumatic events early in life, they may see incidents in very different perspectives as others. This can impact workplace interactions. For example, a situation that happens may not be as serious to one employee than the next because of their past and their history. So what we're talking about here is having a dysregulated nervous system. When this has happened is because you have again, a positive indicator variable for toxic stress in the nervous system. And that's anything that is deregulating your, well, there's parts of the brain, but I don't want to veer off and get into too much of that, because I do have some important content before we get on before 10 o'clock. So here's some of the negative thinking traps. So this just kind of helps you to hear a little bit more about, like, what does that look like if a person is dealing with that impact or having that skewed perspective due to toxic stress. So having a black or white, all or nothing dichotomous mindset. So things are either good or they're bad. They're either safe or they're dangerous. There's no middle ground. And whenever a person's thinking like that, that's that could be something that, triggers you to realize, okay, that might not be the right mind space. And things are either perfect or they are total failure. It's nothing in between. And that is a sign of dysregulation. Okay, focusing on negative or negative filter, right? So focusing on negative things, scary things, unfair things, ignoring good things. So you never see the positive. It's always the glass is half empty. Overgeneralization. So an F on an assignment means that you'll never succeed at anything. That's very extreme. Okay, one bad interaction and you decide someone is a jerk. Something bad in one area means something about all areas. Something tough about right now means that your whole future will be tough. This is not true. This is, again, dysregulated nervous systems. Personalization. Everything is about you. Your friend looks upset, so you assume it must be your fault. Your father doesn't agree with you, so you assume he's trying to make you mad. Okay? Personalization, taking that on you, and it might not have anything to do with you. Catastrophizing. So your friend doesn't call when he says he will. You think your friend must be, that friendship must be over. You forget to turn in an assignment and you think you're going to flunk out of college and never make anything of yourself. That is catastrophizing. So if your mind naturally goes that way, you want to sit down and, just kind of think that through. Perfectionism, setting unrealistic expectations, asking yourself to be perfect, not allowing yourself to make mistakes. This makes you feel like a failure when you do make a mistake, which is only human. And it discourages you from trying anything new, making it hard to get a sense of achievement and preventing you to try new things or things that you might enjoy. Mind reading and acting like you can tell what people are thinking about you. Getting very negative or angry when often it is your imagination. Sometimes you might be right, but most of the time, you got worried and upset over a situation that never really existed. Minimalizing or discounting. You maximize your failures and minimize your successes. You discount positive events and allow negative events to count more. Even though I hit a home run earlier in the game, I let my team down when I struck out later in the game. And blaming. So you focus on the other person as a source of the problem when you may have had some part in it. You expect the other person to change or fix things when there are things you could also do. So those are some types of, specific examples of what to look for when I say a dysregulated nervous system. How ACEs might affect employees. Okay, so you have poor mental health and stress can negatively affect employees in different ways. Their job performance and productivity, engagement with one's work, communication with coworkers, physical capability, and daily functioning. So these are some of those things. What does this look like on the job? Some employees with higher ACE scores may also be less likely to trust others in this environment. Again, when you have that toxic stress in your body, it can reduce gravely your ability to trust others. Adaptation, anxiety, and impact just a few things that can be caused from ACEs. And many times people are not aware of it. So here are some signs of occupational stress that are affecting mental health. Include excessive worrying or fear, feeling excessively sad or low, confused thinking or problems concentrating and learning, extreme mood changes, including uncontrollable highs or feelings of euphoria, prolonged or strong feelings of irritability or anger, avoiding friends and social activities, difficulties understanding or relating to other people, changes in sleep habits or feeling tired and low energy, changes in eating habits, such as increased hunger or lack of appetite. Occupational stress from ACEs may also look like difficulty perceiving reality. So delusions or hallucinations in which a person experiences and senses things that don't exist in objective reality. Inability to perceive things perceived changes in one's own feelings, behavior, or personality. So the lack of insight, or we could call that self-awareness. Abuse of substances like alcohol or drugs, multiple physical ailments without obvious causes, such as headaches, stomach aches, vague and ongoing aches and pains, thinking about suicide, inability to carry out daily activities or handle daily problems, and stress. What can you do to protect yourself from workplace ACEs? So the workplace can be a key location for activities designed to improve well-being among adults. Workplace wellness programs can identify those at risk and connect them to treatment and put them in place supports to help people reduce and manage stress. It is vital to have awareness of mental health, as well as maintaining a healthy life by eating healthy and exercising regularly. To be the best you for your mental health, take time off when you need it. You have to take care of yourself. Remember, they tell you in the plane to put on your oxygen mask before you help anyone else, right? If there is a conflict at work, talk it out. Don't let it escalate. Be transparent with your manager or supervisor to receive the proper accommodations. Work with a therapist or a job coach to receive practical application skills. And that is the end of my presentation today. Sorry that I rushed it, but I wanted to make sure we had time. Here are my references. And again, this is what I spent the time to do my research study on, because I thought it was so important, because so many times people are not recognizing that the amount of time that they take to be in a workspace, or just the amount of time in their life that they're, focused on work. You want to make sure that it's healthy and it's an environment that is nurturing to you, because you don't want to go to a workplace and now find yourself on a lot of different medications in order to support that work. And that is it, that all that I have for you today. So again, thank you so much for your time. Thank you, Rod, for having me. And I really enjoyed being able to present this.
All right. Thank you so much, Dr. Tosh. Dr. Ailes, over to you for questions.